we are moving on now to our next set of lectures, and just to give you an overview of what we will be specifically discussing, we are now looking at lecture 4's outcome. So lecture 3 is 1 to 3 is complete, and you should have 3 YouTube clips for that. Please take your time to go through each slowly, but in the next set we're going through lecture 4's outcomes. So just quickly to discuss and apply the basic guidelines for functional movement screen for youth when determining capacity to participate in health and skill related components of fitness. Discuss and apply the basic guidelines for strength training interventions, especially based on a squat or lunge movement mechanics. Discuss the most common injuries in youth in terms of their musculoskeletal development. Discuss and apply knowledge on monitoring tools available in youth for burnout, and discuss and apply knowledge on early versus late maturation or specialization. Actually, in this case, specialization. So let's start with our first question there, which will align with our objective 1, which is to understand the functional movement screen. Discuss 5 reasons why it is important to implement a functional movement screen with adolescents. So we have done this assessment in a practical together, and you have assessed each other. And as I mentioned, the more you do the assessment and the more you read up on functional movement screens, the more you will identify or be able to identify movement deviations and the need for intervention. So let's just have a look quickly. The following are the reasons to identify joint stability and mobility irregularities for intervention purposes. Pre-screening injury prevention or detection, especially if pain in the test is identified. So you would get an immediate score of 0 if you have pain in the test. Where to commence strength training, as if a child, adult or adolescent cannot even squat or lunge properly, how can they be expected to do a dynamic plyometric based activity? And then asymmetry in movement, hip deviation, medial knee deviation or ankle deviation or rounding of the lower back, and then stability in core in the sagittal and transverse plane. You can quickly tell if someone's core or hip stabilizers are not working. So let's quickly have a look at that functional movement screen again. Remember, for your prac purposes, you should be able to identify what makes a good movement. So a deep squat example is where the hips, shoulders and ears are basically aligned, and that the torso is perpendicular to the lower leg area. If you read through this, upper torso is parallel with tibia or towards vertical, femur below horizontal, knees are aligned over feet. So if a person cannot do this activity, this basic squat activity, and their body starts to look more like this, where they need a heel raise, because if they didn't have the heel raise, they would have a lower back arching, or they would have some other deviation in the upper body due to tight structures in the calves or the hip flexors or the glutes. Or if you look at a score of 1, the individual's tibia and upper torso are not parallel, femur is not below horizontal, knees are not aligned over feet. So if you've got someone who's got medial knee deviation whilst they're squatting, their ankles are inverting, their lower back is rounding, their posture in general is very poor when they squat, then of course you don't want to be prescribing plyometric based training for an individual. So this is your pre-screening. Also, you don't want to be adding heavy weights initially, because you want to first focus on developing the person's motor learning pathways, releasing the tight muscles and strengthening the weak muscles to get their posture to this alignment, which can take quite a lot of time. Okay, so let's look at poor squatting mechanics. Maybe some of you look like this when we squat, or we watch people in the gym and we see the rounding of the lower back, we see the lack of glute activation, knees over toes. So if you had to give this lady a plyometric training or heavy weights, she would obviously get back problems, possibly knee problems, ankles, shoulders. But a lot of us, if we watch people that aren't trained and they're busy training individuals in the gym and they don't know what they're doing, they would prescribe and advance this training program. Even the knee deviation, if you watch this gentleman over here, your knees should be aligned basically with your third toe, so you must create that torsion in your hips, that your knees are slightly outwards, so that you activate your medial glutes and you switch on your glute max, core stays tight, and upper body upright. If we look at this position here, you notice the forward posture tilt, and again the document that you have read, which highlights the problems with the individual if they have any of these deviations. Then again, I haven't gone in depth with all the assessments. This is not within the scope of this module, which is growth and development, but it is highlighting what you do need to know to make sure, at least on a basic level, that your client, your adolescent, is trained correctly, motor learning pathways are established, and actually in our next phase, where we actually start even with the younger years, so that the training years and number of years the individual does the activity is done correctly. So again, you would have a look at this document, which you have, and that'll give you some good indications. Some poor lunge positions. Same with the functional movement screen. If we go back to the functional movement screen, you will see the next activity is a lunge or hurdle step. Hurdle step 3, if the person can maintain Usain Bolt posture, if I can put it that way. You don't see Usain Bolt moving from his hip girdle when he runs. His range of motion in his hip is adequate to allow him to lift his knee high enough, pretty much higher than his knee, to get that full range and activate all his muscles. Some of us in the class, we are more on a level 2. That could be a problem due to tight structures, weak hip flexors, weak abductors, weak core, and so forth. And then of course your level 1 hip lift. So you could imagine this is running mechanics, and obviously if your running mechanics are looking more like a level 1, although this is excessive, but if you do a slow motion video analysis, you'll see the deviations in the postural alignment, you'll see the deviations in the upper body, you'll see the deviations with the individual's biomechanics. So for you, basically you want to know, well, am I going to progress this person to an advanced training program, or what basic strength and conditioning and fascia release programming do I need to do? Another thing you'll notice here is balance. Loss of balance is noted. So the individual can't even stay on one foot without losing their balance. Okay, inline lunge. This is a number 3, and again, your body is maintained in a vertical position. I know that even for myself, because my quads are quite tight, I struggle to get into this upright position. So it's difficult for me to get into my glutes when I do, a lunge position, when I do a lunge. So I probably look more like this than I do a level 3. So I will release my quads and practice on my motor learning pathways. Some of us look like this. Remember, if you get that deviation in the hip girdle and the hips fall laterally, then normally this is your hip abductors that might be weak. Poor balance is another problem. A lot of people forget in their training programs to add proprioception, and then of course you've got imbalances between the possibly between your hamstring tightness and of the muscles, and then also some oblique or lateral deviations, oblique muscles. Okay, so just have a look here. Again, that forward posture, you want to keep your athlete, your youth athlete upright, your adolescent upright, your young child upright. Let's have a look at some more examples here. So again, you would compare these individuals to what makes a good lunge position. Just trying to see if there's any others. Okay, so not too many pictures here. So let's just stick to then this one, which shows us a basic forward lunge position. Okay, then push-up posture for our functional movement screen, other than shoulder mobility. So for those of you in the class who have not yet had a look at what your shoulder flexibility is, you might have asymmetry between the one side of the body and the other. It is important to get your arms to a position where they can nearly touch, or where they are in a fist's hand distance from each other. And the reason for this is to ensure for optimal range of motion whilst you do activities. You can especially imagine with swimming that overarm position and how far the shoulder goes into that range of motion. If you have limited flexibility, that is going to cause shoulder impingement problems. The same goes for throwing, and the same goes for any overarm deviations and problems. Okay, active leg stretch. Before I get to the actual push-ups, of course you want adequate flexibility, and this active leg raise will probably correlate to your ability to lift your leg when you do a hurdle step. So for those of us who have gone through this test, notice the flexibility of the lower body, and again you want that alignment to be near vertical. Okay, so let's have a look at number 3, look at number 2, and specifically what you're looking at is the hips and the shoulder area, where the shoulders are collapsing in, or the hips. Some of us in class are number 2 and number 1. Many of us are number 1. So here's your client. He's busy doing a push-up. What level on the functional movement screen would you place him? Then how would you modify the activity? Same goes here. What makes a good push-up position and what does not make a good push-up position? Okay, this would be an example of a modification so that you do the activity correctly. And again, watch the arms here. You don't want the arms moving medially or laterally. You want the arms in a 90-degree position to the torso. Okay, yes, we do get many different types of push-up positions, but for the purpose of this, you want those arms to be specifically in a 90-degree angle moving down. Okay, this is rotatory stability. A lot of people forget about this, so we do not warm up our spinal region. We tend to focus on just flexion and extension activities, and we don't work in the transverse plane. So again, some of you have a look at this, see if you can cross over the midline, and if you can do it on the same side of the body. Okay, and that's the main reasons for doing a functional movement screen. Okay, and of course for that one question for your class test or for your prac exam, you must know what to specifically look at when you do an overhead squat. What is the correct postural alignment? If there are deviations, just the basics, not in depth. Remember, some of you will do this next year more in depth, and those who want to learn more about it, obviously you can refer to the relevant documentation. You can come and ask me for it as well if you'd like, and you would need to identify how this will form part of your testing protocol. So just quickly to have a look, studies that have been conducted on adolescents. Those of you can go read up more. Normative values for the functional movement screen in adolescent school-age children. So we have read this together, and I've highlighted some of the documents, main points. But for rugby, soccer, assessments as well on adolescents and youth, functional movement screen has been used, and those with a score of some around about 14 or lower tend to actually have a higher risk of injury. But as you can see here, the score, the mean is for the adolescent group seems to be between just on 14 to 15 out of 21, which isn't the ideal, showing you that when youth come to you, they will have functional abnormalities due to the training they've received, due to possible asymmetries in the body, and so forth. So have a look at that, and then of course moving on to our next section, we will be discussing your thorough assessment now that the athlete has come to the bio center. Okay, if you have any questions about the functional movement screen, how to assess it, just the basics, and how you would use it to decide whether you're going to do strength training at a higher level with a participant, as in you're going to be doing snatches, cleans and jerks, or you are going to be adding weights to the strength training regime, or whether you're going to be plyometrics, then come and ask me, but you should by now have a clear understanding of how you go about deciding what postural exercises the individual needs before they progress to more high intensity strength training, power training, speed training. Thank you very much. Any questions? Pop me an email or come and see me in my office.